Well, good evening, everyone, and welcome to the Financial Curve from Commercial Revenue Contracts Policy and Accountability Committee. And it's Wednesday, the 18th of November. And I'd like to welcome you. On the committee, we have 5 councillors. That's myself. I'm PJ Murphy. I'm the chair. And I'll call out the other councillors' names. And when I call their names, if they could just say present, and we'll be able to see them. So, Councillor Patricia Quigley.
Present.
And Councillor Fiona Smith.
Present.
Councillor Guy Vincent.
Present.
And Councillor Donald Johnson.
Present. Good evening.
Good evening there, Donald. And we're really lucky, actually. We have 4 residents on our committee, all kind of fantastic background in finance and commerce. We have Tony Boys.
Yes, indeed. Present.
Eric Holstein. Eric, you're on mute. So.
Present.
Okay. Chris Lidmerton.
Present.
And Judith, but I haven't seen Judith online, so perhaps you sent her apologies. Right, are there any declarations of interest? Okay, and we move on to item 3, which is the minutes of the previous meeting. Are they approved, or any matters arising from the minutes?
Chair, I've sent a couple of clarifications to Coyote, and he's putting those through.
Great, thanks very much. Any other points coming out of the minutes?
Chair, could I just ask a matter arising? Is there anybody on the call who can just give us an update on item 5, the financial impact of COVID-19? Because I know that the figure, which at that point was 18.3 million net adverse impact, goes up and down. Do we have a latest position? If anybody's available, if Emily's here, I don't know.
Emily? You have to go off mute, Emily. We can't hear you.
Maybe that's deliberate.
Thanks, Councillor Murphy. Yes, I can give you the latest position. It was reported, and you're quite right, Councillor Vincent. It changes very quickly and daily. Obviously, there was a recent funding announcement that has happened since we last reported to you. So, we have had some more government granting since then. I would say that this figure that I'm just about to report to you doesn't necessarily include significant additional costs of this second lockdown. At the moment, we're looking at it and we have forecasted it, but again, this lockdown is very different to the first lockdown. So our sort of forecasts on this second lockdown are changing rapidly. But the last position that I can report to you is that, in a sense, that the net effect on this year's budget at the moment, with quite a lot of risk, not knowing what's going to happen in terms of an extended lockdown, is an impact on the general fund of £2.5 million this year. That's on the general fund. We think there's a 3.3 million impact on the housing revenue account, pretty much due to not being able to collect rentals at the moment. And there continues to be the same figure that we've reported to you before, 7.9 million impact on the collection fund. And as you'll remember from me talking to you earlier, we'll be required to spread the impact of that over the next 3 financial years. So that won't be a hit this year. It will be a hit that we would need to recover over the next 3 years. The government said they will also take that into account in our settlement. But when they say they take it into account, we don't know that it will be fully funded. So so in total, Councillor Vincent, a total impact of 13.7 million at the moment, 2.5 on the general fund for this financial year, 3.3 on the housing revenue account for this financial year, and 7.9 on the collection fund that will be spread over the next 3 years.
Emily, that's great. Thank you very much. I would assume that it's more likely to get worse because, as you say, extra COVID costs, which you're currently undertaking because of the new lockdown So
That's
it may get a bit worse.
That we believe it will get worse, and we certainly the impact. As you will remember, the biggest impact on income is in relation to our parking and traffic enforcement. We have modelled a 4 and a 6 week lockdown on that, which with 11 million. Actually, what we're finding is that the impact of this lockdown isn't as severe as the impact in the first lockdown. So people are still travelling, but nonetheless, it is worse than the position we've reported. So keep changing. As soon as we think we've got there, something else happens or another government funding announcement has happened. There have been more funding announcements recently, and so we're keeping on top of those as well.
Thank you very much. No, well, there seem to be a lot more cars around this time around, so
Yeah.
I suspect the parking revenue isn't as badly impacted. Thank you very much.
Okay, Tony, I see your hand is up.
Yeah, indeed. So I find this very interesting that, of course, the lockdowns have brought into some level of relief the dependency on parking fees and traffic-related income. I was going to suggest, I think maybe later in the agenda, it's suggestions for forward agenda items, and maybe one could be the relationship between traffic and income in the broader round, particularly in respect of potential changes to the congestion charge zone, to the emission zone, and of course in the light of directions towards more electric vehicles, which will have an impact. And then, of course, last but not least, the impact of the continued closure of the bridge, which presumably is reducing the traffic flows. So I just wanted to suggest that it might be worthwhile scheduling that as a separate agenda item, which is how to best make the use of traffic income across the borough, with all those factors in consideration.
Okay, thanks very much. Any other matters arising from the members?
Chairman.
Sorry, Chris.
Yeah. Emily mentioned some extra funding from the government, but didn't mention how much it was. Emily?
Thanks, Chris. Sorry. Oh, I can do the mute and the camera, but I can't do them both at the same time, obviously. Sorry. Let me just bring up the latest numbers for you. Off the top of my head, the latest unring-fenced grant is 18 million. That's what I thought. So what's happening is we keep getting different phases of the grant released to us. We don't never know whether it's going to be the last one or not. But the total after 4 tranches to date of COVID grant is 18 million from the government.
So that's not the latest payment. That's the running total you've given.
Absolutely, that's the cumulative total to date of the ring fence grant for COVID-19. I think the last allocation was in the region of 4 million.
Okay, thank you.
Okay, any other questions before we move on, or other points? All right, could I just raise 2 then? One is around the review of the termination of the conditional land sale agreement. That's on point 6. That unfortunately we didn't have the attendance of the people that we invited, former councillors Greenhalgh and Botterill. I subsequently heard from Lord Greenhalgh, as he is now, and I'll send those letters on. I think that they're quite an interesting read. The other point is around the campus programme, and with David leaving the council, we identified earlier the key man dependency that we had there, and I just think we need to make sure that's flagged on the risk register, that the 2 people that had the most involvement and the most corporate knowledge and experience of this kind of work have both left the council, which does give us a key man dependency. So it'd be good to have that on the risk register. Okay, this next item is managing adult social care services, and the idea behind this really is one for us as a pack to understand the pressures that adult social care services are under, how they've been exacerbated by COVID, potential impact on next year, and what we as a PAC can do, if anything, in terms of ideas or support to help the department. Yeah. So we have a slideshow from Lisa, and so let's go through it, and then we can pick up any questions at the end. Thanks, okay. Lisa.
Thank you, Chair. So for those, good evening. For those who don't know me, my name's Lisa Redfern. I'm the Strategic Director of Social Care. Prakash, I don't know if you want to introduce yourself as well.
Happy to. Good evening, committee. Prakash Dharani, Head of Finance for Social Care and Public Health.
Okay. We've prepared a set of slides, which I presume that you've all had the chance to read, but I just wanted to do a bit of scene setting and introduction first before we start, if that's helpful. So adult social care has a gross budget of £92.7 million and a net budget of £55 million. We've got 205 full-time equivalent workers, and we support approximately 2,407 people. In the main, we support people to live in the community with packages of care, either through what's called direct payments, so people supporting themselves, or through the vast majority, I would say, between that and home care packages. And 525 people live in care homes. So I just thought it was important to set that scene, put a bit of context. I think I would say that adult social care is always one of the biggest budgets in any council, and it's always one of the most difficult to manage and most volatile budgets, and that's been the case for years, even before austerity, but has worsened significantly since then. During COVID, the council has received several tranches of funding, which Emily's just alluded to, and which Prakash will detail a bit later in this presentation. A large amount of the money that's been the infection control money that's been allocated to social care has been spent on PPE. We've spent over £2 million on PPE in adult social care alone. And that's in the main been supporting people that live in the community who are on direct payments or personal care budgets that need PPE, or for our care homes and for our home care providers as well. We've actually provided that in order to support the whole system. So I just wanted to explain that. I guess one good aspect to come out of this horrific global pandemic is that people at least now know what social care is. I don't even think before that people really understood what social care was, and hence why it's been so important to, in an awful way, to raise the profile of social care, and why it's so important now that we keep that momentum going, because we need to keep that recognition going, that in order to reform social care. Because it's not about just reforming funding, it's also about reforming how we provide social care and the value of social care, and that it needs parity with healthcare. And in actual fact, whilst most people think the majority of people are cared for in hospitals and in healthcare, that's simply not the case. And I think it's about now trying to build on that momentum that we've managed to that's happened during COVID in the worst possible climate, but actually build that momentum. So turning to the presentation, unless there are any questions from my initial introduction and some of those facts and figures that people need me to qualify. Okay. So some of the key national.
Sorry, Lisa. Sorry.
Yes. Yes.
Sorry, Lisa.
Yeah.
Hi, Lisa. Difference between the gross and the net, and how that comes about.
So, Prakash, do you want to explain that?
Sure. So the gross expenditure is on a range of services that are provided by social care. There's a slide which we'll go into, which is the pie chart. I'll explain how we spend our money. But we get income from various sources. Our largest source of income is obviously contributions from the health. We get grants from government, which are specifically for social care, like the Improved Better Care Fund, and we also we make we make assessments for contributions for clients who are in residential nursing care. So our income is about £38 million. So taking from the 92 that Lisa alluded to, less the 38 is the net contribution, the net general fund for council taxpayers for social care services.
Great, thanks very much indeed.
No problem.
Is that okay? So in terms of, I'll just pull out a few of the key national messages from directors such as myself up and down the country. I think being very proactive in engaging with and taking a range of measures to support providers. I'll talk a bit more about that in detail in the later in the presentation, but I think that's become really obvious during the pandemic. And we actually have, I feel quite proud of what we've done to support providers since the beginning of March. That's not just care home providers, but that's our home care providers, which are we've got an array of home care providers. And I think for the first 3-4 months, we had daily telephone calls and meetings with our providers to make sure we were leading and gripping and supporting our providers, trying to basically work through questions that were coming, not just financial questions, but a whole range of questions that they were worried about: health and safety, PPE, whole manner of things. What's going to happen if one of my carers is test COVID? How will we pay for them? We were one of the first, I think we're the only borough that's offered additional sickness pay for our carers. So to give them confidence to get tested and encourage them to get tested. So we offered up to £200 a week for carers, both in care homes and who are providing home care. So I think having a very proactive, a more proactive approach with providers has come out as a key message. I think one of the other key messages that I wanted to pull out, and you've indeed read quite a bit about this and heard it in the news, we've had a volatile marketplace in adult social care for many, many years. I've worked in and out of social care, certainly since the internal market was introduced in 1990, I think it's always been volatile. I think what COVID's certainly going to bring and has brought is even more pressure for providers, and certainly some care homes we've seen close up and down the country, and we've certainly had to provide quite a bit of financial support, as well as support like I've described around PPE to care homes to keep things afloat. So I think that has come out as a couple of those things have come out as key messages. I think very clear and pertinent to this presentation is that more financial support is required to help manage adult social care response to the pandemic. But as I said in my opening gambit, reform of social care funding, Still Not, I think, was the last kind of major reform into adult social care funding. And we absolutely need to come to some sort of agreement nationally about how we're going to fund social care if we're going to value it. But I think the pandemic has really brought that to the fore, as I said. We've got increasing demographic pressures in terms of providing social care. And as you can see from the slide, estimates suggest 6 to 8 billion level of funding is required to support social care on a more sustainable level and to meet growth and demand for an ageing population. So that's huge. So if we don't come to some sort of solution, either via our national insurance or tax, or whatever funding solution is decided, this will continue to be a problem and a pressure nationally and for local authorities. Prakash, I'm going to hand over to you now to go through the next slide.
Sure. Thank you, Lisa. So I'm on page 13, the social care support, COVID support during this period. This is obviously from the March 19th or so period time. This slide is an update to the slide you would have seen in the October Finance Pack meeting. At that time, we were forecasting in social care at 6.4 million support for social care. Now it's just under 7.4, 7.376. The four main areas, I think Lisa's touched on quite a few of them already, is obviously the extra support for the residents who are requiring social care support, mainly in their homes, kind of thing. And a lot of those in the first tranche of the pandemic were obviously residents coming out of hospital who required greater need, social care need, greater acuity, and therefore the care package was a lot higher around that. A lot of it was coming out under the Care Act easement that the government allowed for, so you were coming out a lot quicker from the hospital to free up the beds around that. So we spent 2.1 million or just over on that number. We sent a small amount to make sure the homes were basically deep cleaned and ready for residents to come back into the homes, 27,000. Then the large area is supporting the market. Again, Lisa's referred to that. And the biggest program there has been the infection control side. We've had two tranches with lots of control, lots of government regulation behind it. So we've had to tease that out like every other borough. Lots of returns back, how we're spending it down to the last penny. Not a bad thing, but it is onerous kind of thing around that when we're trying to support the market around that. So that's been the main area. We have, again, Lisa's alluded to, we have supported the home care market, whereas in the past, we would pay the provider on actual hours. So they will submit an electronic record of the care provided. This round, particularly on the first round of COVID, we have provided it on commissioned hours. So that means there's been an extra cost to the borough around that, but that has provided certainty, to the carers and to the providers. On the workforce costs, we've switched some of our resources from reablement right into the hospital discharge area. So that's smoothed the pathway out and to support the residents as they've come back into home under the discharge to assess model kind of thing around that. So that's not additional costs in essence, but we have to switch resources accordingly. Okay. And then PPE, I think Lisa's already alluded to, I think across the council, we're estimating £3 million, of which £2.1 million is for social care, kind of thing, a size amount. So that's how you get to the 7.3. That's the latest number, which we are including in the monthly MHCLG return. So this ties back to those records going through. In terms of how it's funded, there's a bullet point down there, and this is obviously a finance assessment, obviously with conversations still to take place and be ongoing with obviously the Director of Finance. So we have got 1.6 million now of two tranches of government directly related to infection control that's been passported through to local government, through to social care and out to the providers. We are claiming 1.3 million from the CCG for hospital discharge work. So some of the stuff we talked about on the extra care, extra support and the workforce are funded from the hospital discharge programme. We have put a claim forward for 400,000, which is yet to be confirmed in terms of settlement, but have put it forward through as part of the income loss. As you would imagine, in our placement market, there are less customers going through and therefore less income coming through, 0.4 of that. And the balance at this moment is assumed to come from the unring-fenced COVID funding that Emily alluded to. You will be aware from Cabinet then, on the last bullet point, that overall, and again Emily's alluded to the update this just now, around there's still a shortfall against all the funding streams and a 2.5 million shortfall against the unring-fenced grant. So as I'm talking, this is a moving picture, being updated quite regularly kind of thing. So at this moment, we are assuming we'll get 4.1 off the remaining funding from the unring-fenced funding, but that's not guaranteed as we talk.
Okay.
Is that okay?
Panel okay for us to continue? Any questions or just keep going? So in terms of notable outcomes, I think we've got. I like to think that we've worked as part of a team, and I include, certainly Councillor Coleman, the leader, different parts of the council have worked with us to achieve all of these outcomes, and I think we've done really well. And that's, I don't mean that in any way to sound arrogant at all, but I actually think we've got a lot to be proud of in Hammersmith and Fulham during these really awful times. So in terms of our home care workforce, and I don't know what the panel know about home care workforces, but sometimes they're not the most reliable. So I was really worried back in middle of March when all of this started, thinking, what on earth are we going to do if a lot of home care workers, understandably, feel scared about going into people's homes because they're scared about contracting COVID, taking that home and so on. So as I said earlier, we made sure that we offered support through daily meetings with providers, and a bit like preparing for an inspection or when we're going through an inspection, but we're on inspection and we have been on, it feels like forever, since March. We now, of course, three days a week with them. But really walking them through health and safety requirements and talking through how we can support them with PPE. And they said that we were one of the few boroughs right at the beginning that actually provided the level of support they needed. And we have a really good activity dashboard. And we've achieved 98% attendance by a home care workforce. Even during the height of the crisis, it only ever dropped to about 90%. And of course, that was one of my massive concerns. Here we are, we can't actually visit people in their own home. The social workers were visiting people at the highest, not just social workers, but nurses and so on who we were working with, continuing to have face-to-face contact with those with the highest level of need. However, I was really concerned that we weren't getting carers into people's homes. So it's critical that we kept a very close eye on this. But as I say, we've achieved, I think, as well through improved working with providers, that level of attendance, and that's remained constant for months. And I've got all the activity data to back that up. So I think that's been a really good thing. We've offered a whole range, supported them through all the testing regimes, continuing to support that, and we'll be going through targeted vaccination, and we're going through targeted testing as well. Shortly. So we continue to do that to build confidence. And as I said, we actually offer additional sick pay as well to make sure that carers don't feel I can't get a test because then I won't get paid. And it comes down to that, actually. You have to think through all the sweating the small stuff has been important. How, in the beginning, how were people going to get to Wembley to get tested? If they couldn't go, if they hadn't got a car, how we were going to get them there. There were so many logistics, the minutiae, to make sure that we supported our residents well. The panel will have be familiar with the Hammersmith and Fulham CAN helpline and how successful that has been and continues to be, alongside the mutual aid groups as well. But a few months ago, we decided to take out the middle person, and instead of having CAN refer to social care and so on, we put some social care officers in with the volunteers, and we're taking that forward to as a model for the future, and working that through because it's been so successful in having that sort of streamlined offer to residents, and it's worked very, very well. And certainly, I think up until about June time, we were 7 days a week. We're always 7 days a week in the hospital, and we have the emergency duty cover, but we're offering additional help. But it's worked so well with the volunteers. That's going to offer better quality, but we're also looking at how we can achieve better value for money through that as well, and a better service offer. We've had a case study that's been published in the medical journal, and also with the LGA and with the Director of Social Care Bulletin on our innovative infection control work with care homes. And that was largely innovated through our Director of Public Health, Dr. Nikki Lang, together with Imperial colleagues. And that was just outstanding work on pushing through local testing in care homes when none was available nationally, and we've been highly commended for that. As I say, it's been hugely recognised, the work that we've done, and I think I have to say that we've got relationships, and we've got a collaborative environment now and a protective ring around care homes that we've never had before. I think the level of understanding by hospital colleagues about what social care does and what care homes do, and the high level of need that they're working with, and also from GPs. We've just worked Oh yeah, I just think there's been some outstanding work, but just to be in terms of the case study, that's actually been noted. We were visited by the then head of Public Health England, Duncan Selby, back in the summer, and we were published in his weekly bulletin, and he was full of praise for a lot of the work that we've been doing in Hammersmith, not just in social care, but as a council as well, around our communications, in terms of what we've done, the banners, all of the other pieces of innovative work that we've been doing in Hammersmith and Fulham. And I think in the main that we've got on with things, that we've not waited to be directed to by central government. We've actually got on with things and been quite bold about it. Dr. Nikki Lang has also published a joint blog with Imperial.
Sorry, can I just interrupt you? I think something's. Could you all put your computers on mute, please? Sorry, there's just some sort of background noise coming through there. Sorry, Lisa.
No, it's fine. So Dr. Nikki Lang has published a joint blog with Imperial, and they've cited some excellent examples of their collaborative work. So I think that's another a good piece of news, and that work continues. We've got a weekly business intelligence activity dashboard that actually a lot of colleagues around London have wanted us to share with them because it's so good and it's so rich. Some health colleagues don't even get the data that we get, so they've asked us to share months ago the daily intelligence that we get. So that's been really good. And something I do feel very proud of, but proud of my team, not necessarily just in terms of my own work, that we're on track to balance in terms of our overall spend. Our actual since writing these slides a few weeks ago, our actual projected overspend at the moment is just over 300,000. So we will balance by the end of the year. And we are expected to meet our £2 million worth of savings as well. We're on track to meet those savings. So I think that's exceptional work by my team and people who support them. But those are just some highlights. There's lots of other things, but you haven't got time to listen to all of the things and me shouting loudly about all the things that we've actually achieved for residents. So over to you again, Prakash, to talk through the pie chart.
Thank you, Lisa. So the pie chart is just a presentation of the gross expenditure of social care this year. As Lisa has alluded to, it's £92.7 million. Vast majority is with care providers, or external care providers, 65% of that funding, in placements, home care, direct payments, extra care, daycare, meals and equipment. Virtually all those services have been running throughout COVID, and therefore costs have been incurred. I think that supports approximately 2,400 residents. We have a smallish in-house service, mainly to do with daycare. Now, those have been closed predominantly through COVID, phase 1 and phase 2. But however, outreach work has been undertaken by the social workers involved in the team. So obviously staff costs are a major component there.
We've also sorry to interrupt, Prakash. We've also redeployed those day services workers who've been able to work. If they've not been doing outreach work, they've been redeployed into our reablement team and into other appropriately skilled work, not just in social care, but in other parts of the council as well. So that's to make sure that they're fully occupied during that time.
Thank you. And then again, in terms of our staffing resources, about 12%. That covers all the social worker staff, management and commissioners as well. There's about £11 million. We've got a range of other services that cross-cut departments. So one is the supporting people budget. There's a range of services, not just for social care, like floating support, mental health services, but we've got programs in there for homelessness and rough sleepers, young people and domestic violence. We are in the process of disaggregating that budget for next year to align them more closely to other departments' same initiatives around that. So there's much more control and more value for money behind that. So that's for next year, but at the moment there is a deciding social care responsibility. And obviously we've got the third sector volunteer sector programme which is about £4.3 million covering social care, voluntary sector side of things. So that's your 92.7 million. And then, like I'm saying, on top of that, we are spending projected 7.4 million on the COVID related costs as well. So taking that's about, just over hitting £100 million this financial year on those two areas.
Okay, shall I move on?
Yeah.
So in terms of managing the budget, I guess as I've talked about, it's required an awful lot of leadership and managerial grip in terms of managing the money with providers, making sure that it's being spent on our residents and in the way it should be spent. So that's required an awful lot of input by my team. We have done a lot of social care reviews and we continue to do that. I've got a weekly dashboard that's given to me. I see the activity dashboard, so it's also a good proxy indicator of activity in, workforce activity as well as what's happening, because as I said right at the beginning, my main worry as director has been, are our residents being looked after well? How are we checking that they're being looked after well and that the money's being spent appropriately? So every week I see what I set up right at the beginning was that all social care staff have to contact by telephone or Zoom or whatever other tech. They have to contact. This is on top of the home care staff going in. They have to do, X number of hundred, X number of calls per day. And I see the dashboard, and we've contacted everybody several, many times over the last few months. But also we've paid a lot of attention to doing social care reviews, which is helping us to make sure that we do balance the books, that the care is going in the right place to the right person, and we've kept a very tight control over that. And I've talked about greater use of dashboards. I think our business intelligence team have been tremendous support to adult social care and the council as a whole during COVID. And I think we've got a lot of tailored dashboards that help us with activity and spend. So I think that's been absolutely outstanding over the last few months. Going into winter, we continue with robust infection control in care settings. Our Director of Public Health has changed a post so that we can have an infection control nurse working with us across ourselves and Imperial. So that's a good permanent fixture that we've got for the future. But that's just one angle. But we've done a lot of other things like that. I suppose vaccination is the new show in town, and by the 6th of December, Northwest London will start to offer the Pfizer vaccine to all care home residents and to all care home staff and to those residents in extra care and in supported living accommodation, because the vaccine's not very portable and it's got a high spec in terms of how it's stored. First of all, they're going to focus on that cohort. Then in mid-January, when the AstraZeneca vaccine comes into place, then they'll start to target those people over 80 and also people who've got a range of disabilities, medical conditions and so on, and then roll it out. They're looking at doing 25,000 immunisations a day. So it's got huge workforce logistics for the NHS, but that is obviously going to be absolutely key over the next few weeks. Well, it's key now, and an awful lot of work's going on as we speak together with them around that. As ever, discharge, we have to make sure people are discharged in a timely manner, but we have to make sure that people are discharged safely, that they have a test, and that we ensure that people are safely discharged home, and that's critical. So that will continue as ever in the winter. That there's always a lot of pressure there, and particularly this month and the beginning of December, that's also a lot of pressure. It's also a lot usually means that we have a lot of cost as well. So that's something we have to manage safely, but also manage the whole process very, very well. I think that's all I wanted to mention on that slide. Prakash, do you want to finish off with the future budget pressures?
Yeah, sure. I think so. This, I think, obviously is heavily caveated. The committee will be aware COVID impact into next year. It's fairly clear, even with the vaccine, as you've alluded to. We're fairly well versed in social care and with the accountants and working with the management team around the modelling of it. We have done that, but we also very recognise there's a considerable financial gap in the council's budgetary position. So we have prepared this with conversations that are ongoing around what can be funded and what can't be funded, and what government can potentially provide, hopefully, in the government settlement later in December, kind of thing. So none of these decisions are firm, but this is our current working assumptions that have been presented, and they have been refined with Emily's and the challenge from SLT and colleagues around that sort of thing. So we're not going in there blindly, but we're doing our best with understanding of what the financial position is. On the demographics, we have worked, obviously we work closely with business analysis, and we have modelled over the next 4 years a 3.4% increase in increases in social care need, kind of thing. So that's just under a 1% in our per annum. And that's equating to, on the care budget, just under £500,000, 471k, as a future budget pressure from next year. And I'm only talking about next year here. I've done it over 4 years, but I'm only presenting this year, next year as a first guess. There is a large cohort of learning disability in the children's market who are likely to come into adulthood. Now, we work very closely with children on this, and we're working more and more closely on planning for those children, what the needs are likely to be as they come into adults, what we can do in terms of support them, in terms of employment and early planning, and so on and so forth around that. But there's a large cohort in that demographics likely to increase into next year, and with an estimate of £900,000 into social care. We've alluded to the hospital discharge clients that were assessed into care. They've all have to be government advised. We have to reassess them. That reassessment process starts from September and has to be completed by end of March. At this moment, we don't know whether we'll get ongoing funding in 21-22 sort of thing. So we've got a risk around about £1 million if they are reassessed and come into the social care market. Under care market and inflationary pressures, we've talked quite a bit of theme about supporting the market. Inflation's quite low, but in care market, it's not low, fortunately. And our view is that the support we have provided them this year is likely to be the new baseline going to next year. So we model inflation mainly for the care budget, 4.5%. That sounds a large number, a large figure, but we are seeing, a fragile market, which is even more fragile than in the past. And obviously in social care, there's a statutory duty to market manage the care providers, kind of thing around that. So that's our largest number, 2.4, just on 2.4 million. Obviously a big unknown we haven't done, and it's very difficult to model. And like Lisa's been here since 1990, I've been here since sort of about that time. And it's just harder and harder to model out, obviously, the COVID impact and the long impact. So that 2 question marks, there could be plenty more question marks around the unknown long-term impact of COVID. Obviously the vaccine's good news around that, but many people are at home, many people are isolated with mental health potential issues, and we haven't modelled anywhere near that kind of thing at a local level. So at this moment, we're forecasting a pressure on our budgets and social care of just under 4.8 million. It is a moving target. We would hope some of that is addressed in the budget settlement from government into next year. We're expecting a 1-year settlement next year.
Thanks, Prakash. That concludes our presentation, and I hope it's kind of what you're expecting. And over to you for questions, Chair.
Okay, thanks, Lisa, and also thanks, Prakash. I think just a couple of things come to mind is just a thanks to the unbelievable pressure that your staff have been under and what they've delivered, just by the sound of it, has really been quite amazing. The second part, I think, is this committee looks at the finance piece. So if we can have any questions around the finance piece, then if we can focus our questions on that, that would be terrific. But please do take away from the committee, I think, our thanks for all the work that people have done. Yeah.
Thank you.
I hope that the new head of Public Health England is as appreciative as the previous head. Okay.
Not
Go
sure
on, Tony.
about that, but
You've got your hand up, Tony.
Yeah, indeed. So firstly, I'll echo the chair's comments. So congratulations and thanks from everybody for the fantastic work you do. I think we all appreciate just what a critical component this is, of the society that we live in, to care for people. And then a very brief anecdote, which I will keep brief, Chair, I promise. So on Nextdoor last week, there was a terrible story of this lovely 80-year-old lady who went to a cash machine, took out £140 and then trotted back home. Then she realised she'd left it in the machine and rushed back, but of course it wasn't there anymore. And some people would think, it's being taken back in by the machine. She spoke to, it was outside the Tesco. So she spoke to the management and they said, well, no, actually, here's the CCTV. And the guy just behind you took the money out and away with him, which was terrible. And this got onto this Nextdoor social network. And in short order, within a day, the people on there had set up a GoFundMe page and they raised £375 to go back to this lady. Amazing. And it made me smile. And she was very good. She took 140 and then donated the rest to charities at the hospital. So the point of this was, I know there's a huge amount of willingness, it seems to me, in the general population. So my question is, how much do you do that already? And are these networks and other ways something that you can leverage more? I sometimes feel that the broader population aren't aware of where they can help, they can pitch in, and they can do useful things. And that's my question.
Yeah, great story with a good ending, so for once. But completely agree with you, and I think the last few months have really shown how local residents and social care staff and other council staff can work together more effectively. And as I said, it's just my piece is just a small percentage of what the whole council does. It may be have the biggest budget because of what it does, but it's just a small reflection of what can be done. But we've seen some incredible work from food banks to the working with the social care team. And as I said, I think we're certainly going to be building on, instead of going back to some old models certainly in our frontline social care staff, maintaining that mix of volunteers and also social care staff, and continuing to work much better with the local community. I think the answer to what you said is no. I don't think we have in the past worked as effectively as we could have done, and we absolutely have to continue to build on what's been achieved to transform services, but also to improve services, make them more streamlined, make them more relevant, and build on a lot of the goodwill, but also to try and look at more cost-effective ways of delivering care as well.
That's excellent, and I think one, if maybe the only good thing that's come out of this, is I think people have generally become a lot more aware, a lot more sensitive, and a lot more receptive to the idea of everybody else, the struggles and the challenges. And maybe that'll be the good thing that remains, is how it's making us a more tolerant and more helping society with a bit of luck. Fingers crossed.
Okay. Well done. Thank you. Patricia, you have your hand up.
Hi, Lisa, Prakash. Thanks for doing the report. And as you know, I work with you on a weekly basis. So I'm fortunate in a way that I kind of see it from 2 points of as being a councillor, but also being somebody that has actually shielded. And I understand from residents' point about people being nervous about letting people, care workers, to their home, but also the worry about the care workers themselves. So thank you very much for managing. I really don't know how you've done it. And as I've said to you before, how you managed to keep everything in your head and keep it going has just been fantastic. I kind of really want to ask, if you had a wish list in front of you with no expenses spared, and that is probably not going to happen under this government, given what we've been reading over the last 3 days. But if you did have a wish list, what would you like to see? What would you do first to try and? So sorry for putting you on the spot, but
yeah, no. Well, gosh, that's a lovely question. That's a lovely question, and where to start? I think, Council, what I would say is, I think it's, for me, it's about the reform of social care. That social care starts to be seen as what it is actually. That it provides support to help people to live interdependently at home. That it's valued and has parity with healthcare. I think that's just critical to enabling care support to be improved for people. I think we have some major problems with quality, as you well know, because you're part of the conversations. I think the standards and quality of care is something that we know we have to really work on in care homes and in providing care support. I'm not just talking about home care support, but people managing their own care budgets. So absolutely working to improve the quality and standards of care. We as a sort of a part of councils have been chronically underfunded for as long as I can remember. There's always been rationing in social care, and I qualified in 1987, but certainly over the last 10-12 years it's been really pressurized. And as Prakash was saying, every year we start the year thinking, crikey, how are we gonna do this one? How are we gonna make these savings? How are we gonna ensure there's a high quality of care? How are we gonna deliver on which I think is an incredible thing that the council does, provides free home care support, which it has done since 2015. We're the only borough in the country that provides that, and it's our job to make sure that policy works. It's our job to make sure that policy works, and I for one want to see it continue, but not just work, actually continue to improve the quality. So there's so many things on my wish list, but I think those are some of the things that I'd like to see: a much higher quality workforce, and more parity with health services.
Well, thank you very much, Lisa, and hopefully you might get your wish list one day. But thank you.
Hopefully, yes, thank you.
And some of us believe in Santa Claus as well. Okay, over to Guy.
Thanks, Joe. In fact, I was actually going to say I don't have any questions because Lisa and Prakash actually anticipated them during their commentary. All I wanted to say was a slightly odd thing, I suppose, which is I think to congratulate you both and your teams. I think you've had a terrific crisis, which is an odd way to say it, but I think you've done an awful lot of wonderful things for the local community, and I think it's worth noting that.
Thanks.
Thanks a lot.
You.
Thanks, Eric.
I wanted to sort of maybe ask a question in relation to a point that Guy's made a couple of times linking to budget, and that is, every time we do a budget round, we try and find savings. And the question that often comes up is the savings that we made, have they meant that we've seen a reduction in the services and the capacity of the services delivered? So my question to you is what reduction have we seen over the last couple of years? Has that been directly linked to those budget cuts? And seeing the situation that we're currently in due to COVID, might we see some further reductions in delivery? And if so, what are the ones that we really have to draw a line against?
So again, very good question. We haven't made any cuts to services. That is not something that we have done. I've been here for 3.5 years, and that is not a policy that we've done, that we've been allowed to do. That is just not something that we have done, and it's not something that we will be looking to do in the future. I think I talked about it a bit earlier on, and maybe I didn't explain it as well as I could have done. I think it is my job overall, and my team job, to make sure that care goes to the care and support that we provide goes to the right, follows the person, follows the resident. So I think in order to manage that budget as effectively as possible, we have to make sure, so on a micro level, that care is properly reviewed. So say when someone comes out of hospital, they might need lots of care for the first few weeks, but then reviewing that package at 3 weeks, at 6 weeks, and it may be then we start to reduce that package accordingly, not for everyone, but for some people. So we have to make sure that we're apportioning care appropriately, upwards as well as downwards. On a more macro level, we have to make sure that our commissioning of care with our providers is as good as it possibly can be. So our negotiations with providers, are they as good as they possibly can be? I would say there's always scope for more. I think the closer that we can monitor our providers, and I think this crisis has shown that, the closer that we can monitor our providers and support them, the better the outcomes for residents, but the better the financial outcomes. And I would say this year we've been able to demonstrate that month on month as we've watched our overspend reduce. So because there is no, as in when home care is free, and I'm not saying this is right, but in other boroughs, when someone's had their free amount of care, which is free for 6 weeks coming out of hospital, a lot of people decide, I won't have care anymore, even if they should have care, because they don't want to pay for it or their family doesn't want to pay for it. That's reality. But we don't have that in Hammersmith and Fulham, and that's a really good thing. But what I have to make sure is that we're people who are in receipt of support are people who should be receiving support. So that means managing the whole system very, very tightly, the practice, the management. And there's always room for improvement. But I happen to think that residents are, I think as it should be nationally, if someone needs support, then they should be able to receive that support. I hope that answers your question. I think I've gone around the house a little bit, but tried to give you a bit of a flavour of how we manage the money.
So just as a quick follow-up, Chair, I know that Guy's got his hand up. Just wanted to maybe sort of close this off. Thank you very much for that. The only thing I have noticed that whilst a lot of adult social care was pretty much fully funded or majority funded by various schemes, in the last couple of years there's been more and more of a shortfall that the councils had to sort of look for, and obviously the council wants to do that, it's a priority. But might that mean if the council has less funds that certain services might be reduced, restricted, and from what I understand, it looks like you're considering that this is a priority, and that might mean that one would need to find those funds in other pots rather than adult social, but we've almost ring-fenced adult care.
Well, again, another good question. That's not a decision for me alone. That's a policy decision. But as things stand, I don't see that social care will be deprioritised in any way. I think what we do have to do is, as I said before, apart from what I've just described about making sure we're reviewing people's care in a effective and efficient way, but also looking at other avenues that we can, I suppose, change the business model. I think it was Tony who talked about working with local residents. So continuing to improve how we work with local residents, what aspects. I'm not talking about providing free care, but what other aspects, like some other sort of lighter areas of support, advice and so on, that we may be able to deliver differently. I think also I've not mentioned collaborating with health colleagues, and I've not done that deliberately because I think we're a long way off finding efficiencies through integration. I know it's much been talked about for years and years and years, probably 15 to 20 years in my experience, and I definitely think there's lots to do to integrate services to improve the delivery of care for residents who don't care, frankly, where care comes from. But just want to know that they get a physio or they get an occupational therapist or a nurse or a home carer or a social worker or whatever advice. However, and again, unless that's managed, led and managed very, very well, the whole system, I don't think those efficiencies will be made easily. So I think it's always about how the whole system is led and managed.
Okay, thank you. I can't see any other hands up, so if I can, then I'll just push in with a couple of things myself. I kind of started off by being nice, but I think I reverted to type. So here it comes. I'll ask 3 or 4 questions.
I thought I was getting away very lightly there.
Oh, how could you? How could you? Yeah.
Yeah.
So I'll ask 3 or 4 questions. Then perhaps if you just get them out there, then you can answer them. Yeah? I think I heard that you're going to hit your targeted savings of £2 million this year. Yeah. Is that £2 million off our net spend of 55, or is that savings elsewhere? If it's saving elsewhere on the gross, what's the net saving to us going to be? Is question 1. Question 2, I think, is around, we talked about supporting the market, and we put in £2.25 million on supporting the market and another £2 million on protective equipment. And part of that is the £200 that we've given to help people, self-isolate. And you mentioned things that other boroughs haven't done. Yeah? So when it comes to negotiating with the providers, how are we going to leverage that? So actually we get a recognition and a far better deal than other boroughs who haven't used public money and propped up the private sector. Okay, that's my second question. My third one is around the future service budget pressures. And forgive me for being really evil now. If I was going to put on my, bean counter hat, I'd be saying, okay, you've got a tranche of people moving in from children's services that's going to cost us the best part of £900,000. What's the saving in children's services from that? So is that a greater saving or a smaller saving? Because those two in the overall budget position might wash each other's hands. We got £1 million on hospital discharge, which is funding available till 2020-21. Presumably, if that's going to be covered, then that's a pressure away from us. So that really puts us then down to an increase of care home inflationary support of 4.5%, which can we leverage that, and the demographic pressure, that really the challenges, apart from COVID, coming up in the future. So if those could just be addressed, that would be terrific.
Okay, I will have a go at those, and then so Prakash, do you want to talk about the net saving first of all?
Yeah, sure. So the first point is the savings actually for this year to be delivered in full is 2.450 for social care, and that's off our net budget. So it's roughly 4.5%, 4.4% at the end of the day, kind of thing for this year. This is obviously on top of previous year savings, like every other department, and of course the council, kind of thing. Does that answer your question?
It does, yes, thanks. And to me, that's about, just from what you were saying earlier, Lisa, that just by having a really good grip on things, and the business inside team helping out. And it might be worth us getting the business inside team at a future meeting to talk through the support they've given there, because we had them a couple of years back and it was far more generic, and it sounds very specific here. So that's really nice to hear.
Yeah, I think it's
I'm getting nice again.
Yeah, sorry to interrupt. I think it's improved a lot, and we've been able to tailor. We've been as working in closer partnership. I think over the last year, really, we've been able to tailor what we need in terms of activity dashboards. But I'd say BI, practice and management. It's always all of those things, isn't it? Systems, practice, BI. Good management, create good grip there, really. I think that's an interesting question. You know, on we've been supporting the market. How can we leverage that? Again, I think that for me comes down to we've built a stronger relationship, much stronger relationship. Our expectations are much clearer with them, and also I think they're clear on what we do and how we can support them. So I think that augurs well, really, for future negotiations around inflation and so on, and negotiating contract prices. I think we are so much clearer on what they do and what they don't do in terms of we've got a much closer view on the activity, and because of that closer management. So that means, for example, if we're looking at a new home care model, which may be in the future not just going out to the private sector, it may be more of a hybrid model. We're just having a look at that at the moment. So that we offer some management training and help with recruitment, for example. We're much closer on the amount of care that we offer because we've had a better grip. So instead of going out to the market and saying, I don't know, we need 3,000 hours of care a week, we are much closer to what we actually need, and we've got much better systems. We've also introduced a better electronic monitoring system as well. That's just coincidental. It's nothing to do with COVID. That was scheduled anyway. So that will also help. I'm not sure that I've answered that question that well, but it's one to go away and think about a bit more. I think for me, how can we leverage that? So that's good.
Yes, I think so, Lisa. Because if I'm thinking, that we in the borough have put in money into the sector that other boroughs haven't, then I'll be looking to see what those providers are going to give back to us that will demonstrate. The unit cost for us, I would expect to be lower than a borough that hasn't.
Yeah. Well, yeah. And in terms of the future service budget pressures and potential savings, from I think you described what's the savings from children's services. You also talked about hospital discharge savings as well.
Shall I go? Can I go into that?
But I think it's all in terms of the transition work. So younger people coming over into adult social care, which is in the main are younger people with learning disabilities or younger people with mental health to a lesser degree. Our transitions team are working with people at a much earlier stage. So instead of young people facing a cliff edge of moving from children's services over to adult services at 18, we're starting that support planning at a much earlier stage. We've still got a way to go, but we've actually got a transitions team in place. But if, for example, a young person is currently supported out of the borough in a residential school at the moment, and that's maybe costing, I don't know, £100,000 a year, wouldn't be untypical. If we start looking at someone coming back into the borough, living in supported accommodation with a tailored care support, an employment or education package, obviously that planning has to start early, but that means we can reduce care costs by about 2/3, and that's what we've seen, and certainly that's what I've seen elsewhere as well. But it's all in the early planning really to achieve that. The hospital discharge, again, I'd say that again it's a bit of a repeat of what I've said before. Without making it, I don't wish to make it look easy, because the daily battles we have with health over hospital discharge are quite immense. I think half of my days are spent working with senior colleagues in health about various aspects of discharge. It's about close working. It's about keeping a grip on the practice, the discharge, and also the budget, and making sure that cost shunting's not occurring from one organisation to the other, that we're actually working effectively together. That's not easy, and I don't see any light at the end of the tunnel there. Even with people talking about pool budgets and everything, Prakash will tell you, in negotiating our Better Care Fund deal this year, we've spent an awful lot of time with the negotiations. It is hugely onerous, going through lots and lots of financial detail and evidence to support our bid and our claim, and I don't see that getting any easier in the near future. I suppose you could say as well that there's so much pressure on the health service, and on CCGs. However, we continue to deal with that, and sometimes we have to take legal advice, and we do that. It comes to that in worst case scenario. That's just something that's part of the job. That's just part of the job. But until as a society, as a country, we come to some sort of decision, if we ever do in my lifetime, about how we fund social care support or care support for adults who need it, I don't see that going away. I'd like to say differently, but I just don't see it. So I'm not sure that I fully answered your question, but I've tried my best.
That's great. I think, Prakash, you wanted to come in at one stage. I did. There, did you?
Just on the specifics on the money side of things. Obviously, you've said why, if the children's bill should go down, the adults bill go up, and they compensate each other. And Emily may want to add more to this, because I'm not the children's accountant, so I'm speaking for Tony. They're obviously, as you would know, in the various reports, they're overspending. So I think this will should bring their bill down, but still overspending. And then hopefully the scenario Lisa's alluded to of a 2/3 saving from a child in learning disability in a high placement to a different setting in a social care market would reduce the thing down, but it will still be a pressure for social care. On the hospital discharge, I think Lisa will know this more than I do, is that obviously we are lobbying hard with ADAS, with LGA, to get some more funding, at least for next year, on the hospital discharge claim kind of thing. So this was funding that was given to the NHS, the 1.5 billion, I think you've been alluded to previously. We are getting a monthly claim process going through, and we're pushing hard. Just on a recent survey making that recommendation as well. That'll go to government, treasury, kind of thing around that. So I've put the figure down there, but obviously if we get it through the settlement, fingers crossed, I'm trying to be positive as well. Kind of thing, that would be obviously a less claim on the general fund.
Great. Okay. Well, I think just summing up, just listening to the way that the two of you were working together. Yeah, a concern we had as a committee, 2-3 years back was how well our finance and the client department's working, and it seems to be working robustly. So a big thanks for that. And I think it's a kind of a reassurance for us. I think three other things that came out is, one, I think genuinely, please do take my thanks and pass them on to the teams, both finance and both in the social care and finance, because you've worked extremely well together. On a kind of a more amusing note, I think Emily and Max have got a kind of nice little model here, because they set you a £2.4 million savings in one of the most critical years ever, which probably says that they were under-egging it, and there must be much more in there to save. So I'll imagine that your budget next year is going to say that. I knew you were going to say something. And
high performers always get punished, you see. This is the
they do. Yeah, mid-table mediocrity is far better. Yeah.
We haven't been let off for next year either.
No.
Oh, well, you would say that, yeah.
This is always a problem.
Yeah, and the other one is that the package there just saying how the children's services is overspending and just splashing the cash. So I'm sure that Emily and Max are going to be focusing on that marvellously as well in the coming year. Yeah, and we won't tell them you said that. Well, we might. So, okay. Thanks very much to the two of you.
Thanks very much. Thanks for having us.
Session.
Pleasure.
Okay. And thanks for taking the time. It's a busy time of year, so really thanks very much indeed. Okay, now we're going to go on to the last item on our kind of much more truncated agenda than usual, and that's on the financial impact of the bridge closure. Again, this is kind of a very emotional topic, and if people are watching outside and looking for kind of updates on where we are and what we're doing, and are we going to put another bridge in place, that's not really this committee's remit. This committee's remit is just around the financial aspects of it. So I'm not sure who's going to be presenting on this. I'm not sure if it's Steve or Max or Emily. You've got your hand up there.
Thank you, Councillor Murphy. I think I'll start by introducing this at a high level. We've got colleagues as well from Transport and Highways working more closely with the bridge and on the task force with us today, who are able to answer any questions as we come. So I'm just going to give you a high level really of the key financial implications in relation to the bridge. And you'll be aware that there are task force conversations and that discussions really are ongoing. So I'll just start with a summary for you. So I guess before we start with some of the numbers, essentially, I think it's important to stress that Hammersmith Bridge is obviously it's between two boroughs. It crosses the river and it's between two boroughs, but it's more than that. It's a London-wide asset, and it does have national strategic transport importance, and that's why, of course, the task force have got involved in relation to this. So it's not just of benefit to Hammersmith. And actually, when we look at bridges across London and the road bridges across London, actually, in the majority of cases, they are not held and they're not the responsibility of London boroughs. So only 8 of the 19 road bridges are the responsibility of London boroughs. The other ones being the responsibility of TfL and a trust that was set up by the City of London that covers some of those bridges. And as a result, because of the bridge's sort of importance, actually, bridges historically have been funded by Transport for London. And there is what's called the London Bridges Engineering Group, or LOBEG, if you were to hear that has essentially run the London sort of bridges programme and provided funding from TfL to the bridges. And not only that, but we've also seen precedent for national funding of bridges as key infrastructure assets. So normally Hammersmith Bridge sits with us, but it's very clear the benefits of the bridge are much broader than Hammersmith, and also that's been recognised through previous funding, both through national and certainly London funding. So if we look then at what we think the bridge repair costs will be, that they're very significant. They're significant capital costs for repair. So just for stabilisation of the bridge, that will cost £46 million. That would need to be completed before any full restoration, and the stabilisation would allow the bridge to be reopened to pedestrian and cycle traffic, and would allow river traffic to pass underneath it, but it wouldn't restore the bridge to allow motor vehicle traffic. And in order to restore the bridge to allow motor vehicle traffic, we're looking at repair costs of 141 million. Very significant capital costs. So as a result of this, I mean, you'll be aware that this council has had concerns for some time over the state of the bridge, and has made a number of funding requests to central government for the funding of this bridge, and in fact the council continues to press for confirmation of funding through the task force. So we have a request for funding going to the DFT congestion fund in December last year, so almost a year ago now. We had a funding request going to the local majors funding in March. And again, as the result of COVID and the government looking for shovel-ready schemes to invest and to put money back into the economy, we submitted another bid in July 2020. So 3 bids that we have made within the last year, none of which have provided confirmation of that funding, and the discussions therefore continue with the task force with regards to funding that bridge. So where are we in the meantime? Clearly that significant capital cost isn't something that the council can commit to. But we have been spending money in order to continue the safety inspections, to keep the bridge stable, monitoring systems, and any sort of minor maintenance that's required. So our spend last year on the bridge was 1.2 million. It was expected that would be funded by TfL, and we still expect that to be funded by TfL, because that's where funding for the Hammersmith Bridge and bridges has always come from this LOBEG group. And essentially, in order to keep this safe, in order to monitor the bridge and to stop it from getting any worse, we are considering, we have incurred considerable expenditure, essentially at risk, hoping and expecting that this will be funded, but we expect those costs to be in the region of 2.7 million per annum. Clearly another significant commitment by the council. And one of the big spends that we have had to do is there was a leader's urgent decision on the 1st of September to enable us to purchase a temperature control system. That was almost £500,000, £420,000 to purchase this system, and it has ongoing maintenance costs of around the same, about £417,000. Those figures are interesting in terms of that capital investment of 420 for the temperature system, because we've looked at spend on bridges based on government statistics across the London boroughs with bridges for the last 10 years. And the average spend within all of those London boroughs was about only £400,000 per annum. Well, only in this context is quite a lot, but it's £400,000 is the average spend per annum. So we've spent that already, at least in just the capital investment for the temperature control system, and we have continuing safety and monitoring costs that we will be incurring. I probably don't need to tell this committee, because this committee, being the Finance Pack, is very well aware of the significant funding reductions that this council has had and that local government has had, and that we've had a real terms decrease in grant of 54% over the last 10 years, being £68 million. That's on an annual basis. So you know that the council doesn't have significant headroom to fund these significant additional capital costs. You also know that there's significant uncertainty over future government funding in relation to the Fair Funding Review, social care funding and business rates reform. And so it's imprudent really for the council to enter into any significant long-term commitments when we don't have a clear view of the funding that we are going to have, even at the moment next year. So at the moment we don't even have a funding settlement for next year, although we expect it soon. And I guess lastly, this committee also knows and has expressed its own concerns over the level of reserves that the council has. So the expectation that the council has significant reserves set aside to fund such a significant capital investment is just not correct. You'll know that we have significant commitments against our reserves in the next few years. And I think, as we've seen in councils across London in responding to this COVID-19 situation, how important a level of reserves is to manage these financial shocks, really, and unforeseen circumstances. So essentially what I'm saying is that the council is in a position where it's unable to fund such a significant capital cost to ensure the repairs of this bridge get completed. Not only unable, but that it shouldn't, because there is an expectation, and has always been an expectation, that these bridge costs are London or national issues which should be funded on a London-wide or a national basis. So that's a summary from me, but as I say, I do have colleagues who have much more detailed knowledge of some of those costs if you have any further detailed questions.
Okay. Can I just ask, you talk about a future £2.7 million per annum running cost, just to kind of keep it in situ. I'm kind of slightly confused because from memory, there have been announcements from the government or from politicians that the money is there. So there was a quote that Zach Goldsmith would get the money when he was returned as an MP. There was Sean Bailey interviewing Grant Shapps at the Tory Party conference saying we've got the money in place. So I'm confused as to why things are not moving forward as we would like.
Chair, it's probably given that there's a danger of Emily being pulled into the party politics of this, it's probably better I answer that question. You're quite right. There is a sort of parallel universe that we're living in, whereas, for example, the MP for Richmond Park, Sarah Olney, on the 21st of October, asked the Prime Minister about the repair of Hammersmith Bridge and whether we could get any money that could be front-loaded. And he replied that Sean Bailey, the Conservative mayoral candidate, would get the money and the bridge was going to be fixed. And then on the 27th of October, so barely a few days later, I got a letter from Baroness Vere, the minister, who, and I understand sources close to Baroness Vere had briefed the residents' groups, which were largely in Barnes, to say that the reason they hadn't been able to progress anything on the bridge was because Hammersmith and Fulham hadn't submitted a plan and wasn't putting any money in. Now, I obviously wrote to her on the 28th to point out that not only had we submitted the plan, we would resubmit it again, but we'd submitted a number of bids on top of that along with our partners in TfL. So I just, when I step back and look at it, I've been away for a couple of weeks because of a family bereavement. And it has given me perspective. I just think that they're messing with us, really. Because, you know, even on Sunday night, a former council leader and member of the House of Lords was tweeting that we should pay for it by using our reserves to borrow against. Well, that would cost roughly £7 million a year, because obviously when you borrow, you have to pay the loan back. It's not, it comes, you know, on an annual basis. That would cost roughly £7 million a year. Now, you've heard the pressures adult social care is under, you've heard the pressures children's social care is under, which are our two biggest spends. And we're a well-run council. I have no potential to go bankrupt, but Croydon's just declared bankruptcy. I understand Bexley and Windsor and Maidenhead are in similar financial problems. I think other councils are doing that. You know, I'm simply not prepared to risk the finances of the council on this. So the only option then becomes a toll, I think, and that's the only viable option. You know, the task force was announced on the 9th of September. What's that? That's about, is that 8-9 weeks ago? I think it is. I wrote to the minister on the first, that week after it was decided that a task force would be set up, and said, look, we need to avoid the political shenanigans which have plagiarised this since the general election, when Zach Goldsmith and Grant Shapps, Secretary of State, were standing on the bridge promising money and saying they'd get it all sorted. And we just need to cut through that and deal in a very business-like way with getting this damn thing fixed. And I said to her, I think the task force should last no more than 2 weeks, because I'm concerned that sometimes in Britain they set task forces up to kick things into the long grass. And I suggested an agenda that I think had, from memory, finance on as an item number 3. When we met the week later, there was no, finance was removed from the agenda. In fact, we only actually spoke about finance 5 weeks in. And that was only because there had been a press statement agreed that said we'd made significant progress. So I raised the point, how can we say we've made significant progress? We haven't done anything, but all your officials have done is recognise that the work we in TfL have done with our engineers has been pretty robust. Might be 1 or 2 things you want to change, but broadly it's pretty solid work. And what's now needed is to move on to a procurement stage. And at that point, we ended up in some very loose conversation of finance. Now, just to go back a little, so I honestly am perplexed. I scratched my head. Baroness Vera had raised that at the last meeting I was able to attend, which was just over 2 weeks ago, she raised the fact that she'd had a bid from Suffolk County Council for a bridge in Lowestoft, which I used to live in Lowestoft, actually, I know quite well. And they put money in based on that bid. She'd had another one in from Great Yarmouth, and the night before the public meeting we had, which was on the 27th, Baroness Vera was tweeting about a bridge about road infrastructure works in Cumbria. And all 3 of those were for the economic benefit of those counties, and those counties had capital they could put in. Now, I'm pleased about that for those counties. Hammersmith Bridge, nearly all the complaints I've had have come from south of the river, largely speaking. And people in Barnes are in a very difficult scenario, which I'm deeply sympathetic to. But we don't have £141 million capital to put in, and to borrow it to cost £7 million. The talk about our reserves is ignorant. There's a paper on the reserves, which I think has been circulated. But clearly our reserves are under the national London average. And the reason you have reserves is to deal with things, for example, like pandemics. We spent £25 million on the pandemic in our first 6 months, keeping people safe, making sure PPE was in place, like sanitizer, which no one knew we would all need, was in place, and taking a variety of different measures to protect the citizenry, which is what our fundamental priority is to do. There's every chance we spend a similar amount again this winter. There's no certainty as yet, because the government hasn't told us what money it's going to give us for this year's annual budget. So we could be having our meetings to agree our annual budget in December without actually understanding what the government settlement will be. And within that, we're getting pressurised to pay £7 million out of loans or to find money from the reserves. I think people are playing games and messing with us, and it's irritating for me. It's desperate, I think, for the residents being affected, particularly those in Barnes and South West London, because they're getting messed about. And in fact, a letter, I think, came from Sean Bailey last week or this week, I'm told, saying that he's got the money again. So we seem to be in a very strange set of circumstances. What I think the Finance Committee needs to do is to take a view on what we're doing. I have opened up talks with private sector people about a loan via toll, because I just don't think I don't think we're going to get anywhere with this government, to tell you the truth. I think they think there's votes to be won in it by making people angry. It's a standard technique: get people angry, see if you can direct the anger at those in charge. But they're in charge. The task force took the whole thing over. Just giving some background to where we got to start off with. Gareth Roberts, the leader of Richmond Council, is a very good man, and I agreed that we were getting nowhere over the summer and needed to write to the Prime Minister to get government engagement, because Hammersmith Bridge is a strategic piece of London infrastructure. Unlike other bridges in London, it's an ancient piece of engineering. It looks like something from Chitty Chitty Bang Bang. It doesn't look like a modern piece of infrastructure for a 21st century city. It's a beautiful thing. We're all very proud of it, but that's what it is. So we wrote to the Prime Minister, and after that, a meeting was convened between our officials and DFT and TfL. And at that meeting, DFT briefed via our officials that the Prime Minister had phoned Grant Shapps, the Secretary of State, and told him to get the thing sorted out, which was very encouraging, and that therefore the DFT said to Sharon Lee, who's our Director of the Environment, it's not a case of when you get them, it's not a case of how you get the money, it's which budget we take it from, and you will be getting the money, because this is very important. And that was very good. And so when I was told that the Minister wanted to speak to me on the 9th of September, Sharon briefed me that he's going to tell you you've got the money, and that, you know, this is a piece of London infrastructure, and this has all gone very well. Well, actually, I got a call. So I got a call on, I think it was on the 8th. I got an email on the 8th of September to say the Secretary of State would want to talk to me early the next morning, and I was very pleased about that. So I readied myself to have that conversation. No news came through after that. I think the email came through something like 10 o'clock at night from memory. Then I got a call to say that the Secretary of State was going to be calling me at 3:45, I think it was, that afternoon on the 9th. So I thought, fine. Then I got a call from people telling me that Grant Shapps, the Secretary of State, was going to be giving a press conference on Hammersmith Bridge at 11:30. So I thought, that's strange. He's doing a press conference on Hammersmith Bridge at 11:30, and yet he's calling me that same afternoon. And then I got a call to say the Secretary of State's cancelled his meeting with you, and instead Baroness Beer, the under Parliamentary Secretary of State, will be calling you at 11. And I spoke to her, and to be fair to her, she wasn't briefed, and I think she, you know, during that conversation where we agreed, you know, I mentioned the task force should be no more than 2 weeks. We've done the work. I'm more than happy for you to check it. That's what you need to do that. But I think it's a 2-week quick piece of work, and then we need to work out how we finance it. All that conversation was very cordial. But when she said to me, you need to keep this quiet, that we're setting up a task force, I sort of pointed out to her, well, it's been, the Secretary of State's announced it on Twitter, and he's actually giving a press conference at 11:30. And she was like, is he? You know, so he gave the press conference with Sean Bailey, the Conservative mayoral candidate. It was very reminiscent of what happened in the general election campaign, which is every time I walk past Hammersmith Bridge, there seems to be a government minister standing on it doing some type of photo shoot or a video, and said that he was going to knock heads together and would set up a task force to effectively take over the scheme. So I was a bit alarmed at the last meeting I was able to attend that the secretary, that Baroness Leah then said to me, I don't know why we're running this task force when people like in Lowestoft, for example, have put a bid in for their bridge. It's to a degree, it's a bit of a shambles. The risk for us is around finance. I think there's a lot of political game playing going on. I think our opponents think there's votes to be won off this. I think the truth will out, and people have no time for that type of stuff. I have no time for that type of stuff. There's a time and place for electioneering. Certainly not when you're trying to deal with people's lives being affected by the closure of the bridge. Now, if we had £141 million sitting around, we'd fix it. If we had £46 million, which would allow the boats to travel underneath the bridge again, we would immediately fix it. There was a bit where we were being advised that they could fix one of the pedestals for £4 million, or they could put a banding around one of the pedestals, which is the pedestal where the super microfractures expanded. And they expanded after, I think, 5 days of the hottest weather since 1965. So the temperature just changed the nature of the cast iron and caused the risk of the bridge being ready to collapse. And there was talk about, well, that'll only cost us £4 million. And we do all 4 pedestals, it'll only cost us 16 million quid. And I genuinely think that the government really thought we'd been doing nothing, and that they could just come in and for something like 16 million quid, or a small amount of money like that, get the thing fixed and open to pedestrians. So the only way that got stopped is when I said, well, look, I'm not clear about the corporate manslaughter charges, that if this bridge does collapse, which is what it's at risk of doing, but are you saying that if you're going to force the bridge to be opened for 16 million quid without actually doing 46 million pounds worth of essential safety works, you'll take over the legal responsibility for the decision? And they backed away as soon as I said that, because clearly they wanted that legal responsibility to rest with me. So my fundamental view is I'm not putting any lives at risk. I'm not going to risk the lives of people. So there's some get fix quick scheme that might sort of get the government task force off the hook. If we could open it, we will open it. But if there's a board of engineers, expert engineers, who review, it's called the Case for Continuous Safe Operation Board, CCSO. And I'm a politician, I listen to their advice, they're the experts. And that's essentially who we will rely on the decisions making, whether the bridge opens or not. And I think that's the only way to do that. In terms of the money, I think we do need to shoot this fox that is running at the moment. We can just take it out of reserves. It's an ignorant and stupid position based on a lack of knowledge about our reserves. This committee will know full well how stretched our reserves are, what they're for, what the legal constraints are. But it's part of the political shenanigans that's running. And I think it would be very good for the committee to take a view on this, particularly the independent members. I'm happy to answer any questions, but you can see having been away for 2 weeks, I look at, I scratch my head and look at it and think it's just madness what's going on. It's very, very, very.
Thanks, Stephen. It's good to know we're going to be guided by the experts. I have two hands up. I have Guy and I have Max and I have Tony. So if you go to Guy, then we'll go on to Max, then we'll go on to Tony. Guy?
Thanks a lot, DJ. A question, I think, for Emily, actually. I've got 2 questions. The first one, I think, for Emily. We touched on it earlier, actually, which is about the loss of income, potentially, from the closure of the bridge. Do you think there is any loss of income for the borough in terms of, as we were talking earlier, about parking or whatever it may be? And secondly, linked to that is, do you think there's any damage to the local economy? Because certainly I've had businesses tell me, not all of them, but a few of them have said to me they think that they are actually losing money because customers can't get across the bridge at the moment. Do you have any views on that? And then I've got a second question after that.
Thank you. In terms of loss of income from the closure of the bridge, in fact, both of your questions, I think it's very difficult to tell at the moment, particularly because of but particularly because of COVID, because it's quite difficult to separate the two out. And clearly, we are seeing a loss of income in relation to parking. But to be able to say whether that is due to the bridge or due to COVID is quite difficult to say. My feeling is probably not. I don't think people necessarily come across to park. I think they often find the traffic is often working its way through the borough, although there will be some parking within the borough. So in terms of similarly damage to the economy, again, because of the significant impact that COVID has had, it is difficult to try to understand what's COVID related and what's bridge related. So I think I simply can't answer that one at the moment. Only that certainly I don't believe there's a significant loss of income to the council, particularly because of the closure of the bridge.
That's very helpful. I mean, as I just get told by some shopkeepers that they're losing custom from people who would normally have come from Barnes but can't get across. But anyway, that is anecdotal. The second question, which I don't know whether you can answer it, maybe one for Steve, is whether you can tell me whether or not something is an urban myth. There is an urban myth, I've been told, whether it's true or not, that TfL, possibly the group Emily mentioned earlier, have what's called a bridge fund, and that there used to be a bridge fund which was topped up regularly by TfL in order to deal with issues like this, but that when we went and asked about the bridge fund, TfL opened the box and found that there was nothing in there because about 40 million, the money in there, had been spent on the garden bridge, the aborted garden bridge by the previous mayor. Is that an urban myth or is that true?
You want me to start?
It's a little bit of both. So the bridge fund was never that substantial, and for a long time, Lowbeg, the committee you're referring to, had been saying that, look, we're going to need to save up quite a lot of money to spend on Hammersmith Bridge. Because, to give you an example, Hammersmith Bridge was opened in 1887. It's made of cast and wrought iron. It's a bizarre structure because cast iron shatters, and it was the first suspension bridge across the Thames. You compare it to Wandsworth Bridge, which is also being repaired at the moment. That's opened in 1941. It's a steel cantilever bridge, and that will cost £6 million to fix. So a lot of these other bridges aren't that expensive to fix. Our bridge, which has a variety of different ancient mechanisms, it is very expensive. And I think what Lowbeg did is that we're going to need to save quite a lot of money for Hammersmith Bridge because the cost went up, 25 million and 40 million, and then the more we hired more engineers to pull bits of it off and look at it, realise the level of rot and corrosion, and indeed then found the fractures in 2019, the more the price went up. And that just was never suited for Lowbeg's budget. And they would take all that money from TfL, who paid for nearly all the structure. TfL paid for all structural works to all bridges, because all bridges are part of TfL structure, a strategic road network, particularly the strategic bus and public transport network. Boris Johnson, I understand, spent £63 million on the Garden Bridge. And I'm not sure that came from Lowbeg or from another bridge budget. So it's certainly true that £63 million was wasted on that. I think £30 million was spent on, remember the high wire the Prime Minister was waving the 2 Union Jack flags famously on? I think that was over £30 million to put that in place. I may be wrong. I'm quoting from memories. But all of those stretch for river crossing budgets. And the thing to note is the average London council over the last 10 years has spent about £400,000 on its bridges. And TfL spends, and prior to that, the Government Office for London, and prior to that, the GLC, spent all the money fixing London bridges themselves. And it therefore begs the question, why would a small West London borough, after 10 years of austerity, after COVID, with complete uncertainty over the spending, so we still don't know where we are now, as of today, in mid-November, why would you expect a small council to pay for everything when it's such important for the London infrastructure as a whole. And I don't think we should ask our residents and businesses to either bear the cuts or pay the taxes for this. And I hope that probably gives you a bit more than you asked.
Thanks a lot. Thanks, Steve.
Thanks, Max.
Nothing from me, PJ. There must have been from the last item.
Oh, sorry, my mistake then. So, Tony?
Let me just switch my microphone. Yes, thanks, Chair. I'll keep it as brief as I possibly can. You guys know me.
Yes, we're worried.
So, I spend
we
quite a bit of
want
time.
to be finished by midnight, Tony. So go on.
I'll keep it brief. I spend quite a lot of time in South America, and the capital city where I go recently built a massive amount of infrastructure, new motorways, underground and overground trains running along the centre of the, all sorts of them, all for zero cost. And that was all done through private equity, and then paid back through tolls on the motorways at very, very, very reasonable rates. And in the UK in the last year, I'm aware of an Australian company that's bought. There seems to be a lot of demand from private equity right now for solid stuff. So one who bought a whole tranche of telecommunications network up in the north of England. So it occurred to me, have we done an exercise to look at, could we get private equity funding based on applying some tolls on the bridge of any nature? And if so, what sort of tolls would there need to be, and how long would that need to take place? Has that been looked at all?
Yes, it has. We are looking at that. I became, after the second task force meeting, I became particularly alarmed that it didn't seem to be going anywhere, and we've been talking to private sector providers about the possibility of doing that. I mean, to be fair, TfL and Richmond Council did not want a toll because it has the effect of shifting traffic onto other bridges. And so they didn't want the congestion, understandably, around Kew Bridge or indeed around Putney Bridge and others, because people will avoid it. But I think everyone's realised now, if the government's just not going to be straightforward with us and provide the money, there's a good, strong Keynesian economic argument that why the government should actually fix some infrastructure, especially in the capital city, which the whole UK economy is based on. But if it's not going to do that, then we've started talking to private sector companies, and are keen to have to see how those options flesh out. And we don't yet know what the toll figures would be. I'm very keen that Hammersmith and Fulham residents shouldn't have to pay a toll, but we'll have to see how that plays out.
Yeah, no, that's good. And I must say, I've read your reports on the performance and behaviours of the various ministers, and I find it quite shocking, quite disappointing, really, that they're behaving in such a manner on something that impacts so many residents in this part of the world. But ever this way. So there's nothing legally to stop you from securing funding because you own the bridge. So.
No, we would need. I think we need an act of parliament to allow us to do a toll. What my understanding is, we would need to get a change to allow that to happen. So it's not simple.
And then they might block you there as well. Say you can't have the money, but you can't have the tolls that would allow you to raise the money either. That would be great. But hey, you've got to keep trying. Well done for your calmness as well. I have seen the reports of how it has all been going on, and your calmness is to be commended, I would say.
Yeah, I think it's irritation you're viewing, quiet irritation, but thank you for the compliment all the same.
Not at all, you're better than me. I'd be mad by now, but you're much calmer than I would ever be.
It's just the front I'm putting on.
Good, excellent, thank you.
Okay, let's move from the loving to Eric. Go on, you got your hand up, Eric.
Hi, just picking up on Tony's comment and that he mentioned about the governance of the bridge and what the council is or isn't able to do as far as what room for manoeuvre you may or may not have, and then what legalities mean. If to what extent do you suddenly become responsible for anything as far as risk is concerned if you decide to go sort of down the road of a toll, or obviously you just said that Parliament needs it, but it's basically what is the governance, and then what are the risks involved in going down A, B, C sort of routes? Have we done anything, and could the committee maybe see some of that work that you might have been under?
Yeah, but it's very tentative, and sort of the officers are looking through that at the moment, and I think probably much of it is commercially confidential, given where we're at. But my view is we need to try and get a structure in place to replace it as quickly as possible. It's odd how the law is, because we're legally obliged to maintain Hammersmith Bridge. We're not legally obliged to provide a new bridge, which may be the solution, and we're not legally obliged to provide river crossings. That's that's other authorities. So it's a classic sort of constitutional mishmash that you see in Britain all the time. But we're very committed. I'm very pleased to work so closely with Richmond Council. I'm very grateful that TfL stepped in very quickly and allowed us to use their procurement frameworks, which expedited things, and indeed to share quite a lot of their expertise. The difficulty is we're now losing time, because we've got to the stage now where we need certainty around funding in order to be able to procure the next stage of works. And that would certainly be the easiest thing to do, was to get some certainty around the funding, get the 46 million quid. If we'd got that in September, the bridge would be reopened in June. And given that there's lockdown going on till pretty much June, when I think by the end of June, we're hoping that a large proportion of the British population will be vaccinated. So you can see that around that time, whilst there's lots of people who are going to be inconvenienced, particularly school children, people needing to go to hospital, etc. But around June, when activity begins to pick up again, we could have had it open to pedestrians and cyclists again. But so far, we've had 10 weeks where we haven't made any significant progress. And it will now not open again, even if we got the funding tomorrow, until at least mid-September. And I don't expect to get the funding tomorrow. So it is delaying things, this uncertainty. And that's why I'm also scoping out private sector options. But as yet, we haven't got the details on how much the private sector will want, and where they have submitted stuff, then it's commercially confidential. But as soon as we can release that, I'm very keen to put it into the public realm.
That'd be great, Steve. Yeah. Thanks very much. Just before we close off this agenda item, are there any other questions coming? I don't see any hands up, so I'll take it that there's not. Just a comment from me, if I can. I just find it staggering when we find out that a go-between on PPE funding,
hello and welcome,
PPE procurement, has earned himself £22 million for introducing one person to another person, and the kind of links that we've recently seen between the government and their mates and money going for COVID work. I just find it staggering that we can't find the money for the bridge, but then I guess you'd. Well, I think so. I just am. Yeah. Sorry.
It would be worth the committee clearing up some of the misinformation that's circulating about our reserves and the fact that we loaned them at some point to different councils. I think there's a lack of understanding. I mean, it's been spread maliciously, I think, but we've got all this money in reserves. Why not spend it? But there's a lack of understanding of what reserves are, when councils loan. I think most of the money we loaned was from the housing revenue account, which you're legally not able to spend anything other than housing anyway. But it would be good to just have maybe Max go through that, so that it's on public record, whilst the reserves are not really an option. And I noticed the government minister was tweeting about it, and former council leader was tweeting it on Sunday night. So I think it would be good to shoot that fox, because if we could just use reserves, then clearly we would. But there's a lot of people getting very excited about that for all the wrong reasons. Some of it, it's just.
Yeah, if Max, you could kind of put something together for us on that, and we can put it onto the minutes, that'd be terrific.
Sure. Yeah. Obviously, the committee discussed reserves in the past, and ahead of the next budget cycle, we'll have an updated reserve paper that reflects what we set out to do at the beginning of the year, which was to strengthen reserves, which is what auditors advised us to do, because our reserves were lower than London average, as we discussed at the last set of budget meetings back in January. we'd set out at the beginning of the year to do that and set aside money to increase the reserves, but also, as we discussed at the very beginning of the meeting, we've had these calls on reserves to fund COVID costs, which the government had said they'd pay for, but are now not going to pay for. So there's two moving pieces. But at the end of the year, we'll have a reserve figure that'll probably be in the order of £80 million, which again it will put us a bit below London average. So certainly not in a place where.
Sorry, Max, was that 18 or 80?
80.
Thank you.
Which is in line with what we were planning, less a bit for COVID. But the general fund in-year COVID amount that Emily said at the beginning of the conversation, and then potentially some further COVID losses through the second wave. That still puts, obviously it sounds like a lot of money to some people, but actually, as I've been saying, it puts us at just below London average and not in a position to just dip into those reserves because that would leave us in an even less financially resilient position. So we'll have a paper on that to come shortly. There's been some speculation in the media about what we're doing to keep the money that we hold, which is reserves and other cash balances, sometimes that we hold on behalf of other organisations like the government or the housing accounts cash balances. There's been some speculation about how we do that. This committee's actually discussed and voted every year on what our treasury management strategy is. So you guys will be well familiar with what our plans are. One of those counterparties that we've discussed as a committee and that we use is other local authorities, because we know that unlike banks, for instance, if a local authority gets into financial trouble, the government will step in and bail them out. So it protects those loans that we make to other local authorities. But our treasury team has been sticking within the treasury management strategy that we've discussed at this committee every year. There were some crazy numbers floating around in one press article saying that we had £500 million lent to other councils, which was completely false. As this committee will know, we're only allowed to lend up to £200 million to other local authorities. And all they did was take the same figure, I think it was 174 million, and they looked at it on 3 different quarters, the same loan 3 times, and they multiplied it by 3 and then announced Hammersmith and Fulham Council have £500 million of loans. So there is that level of disinformation going out, and we'll make sure that the next set of budget papers do make it clear that the Treasury team has been sticking within our limits, and we haven't just invented money out of thin air to loan to other councils. And but the end result of that is you end up with the position that Steve has set out, is that we're well managed financially, but as a result of 10 years of austerity and now as a year of COVID, we're always operating in extremely difficult circumstances and having to make sure that we're extremely careful with our money. And the reserves that we have are set aside very carefully to protect us, to handle things like COVID, and certainly do not put us in a position to all of a sudden spend huge amounts of money on something that for decades has been funded by the Transport Authority, which is TfL, supported by central government.
I think also it's worth making the point that money that's been publicised is money that's already been earmarked to be spent, so it's not free money that we can just give away. So
exactly, okay, a large chunk of it was actually the Earl's Court money, which we discussed in the last pack.
Yeah,
we were sitting on a large amount of money which we weren't legally able to use until the West Ken and Gibb Street Green estates were fully sold and passed the developer, which obviously, as we discussed at the last committee, would have left us in financial ruin. So that deal was terminated. That money's been returned to the developer, and we don't have that money anymore, which has actually left us in a much better financial position, because we don't have the obligations that would have gone with that, of having to pay out to leaseholders well in excess of what that money would have been.
Great. Okay. Thanks very much, Judith. I saw you have your hand up.
Yeah, I put it down again. I was just questioning the 80 million reserves number, but I think I don't want to take us down that rabbit hole if we're going to have an update in due course. Because that is a longer conversation.
Yeah, we can. Yeah, we'll have that conversation. You probably don't recognise the figure because I've combined what we often talk about here as the reserves with the general balances.
Yeah, exactly.
That's why that figure sounds a bit bigger than you're used to, but it's definitely in line with the numbers that you've seen before. It's just I've combined a few things when I gave that figure.
That's fine. I'll wait for the official update later in the year.
All right. Well, thanks to Emily and to Steve and to Max for the update. Really appreciate it, and thanks very much for the questions. And that brings the meeting to a close. Just before we go,
I can't get out.
We can hear you, Chris. Yeah. So just before I bring the meeting to close, I just want to say this is my last meeting of chairing this committee. I'm moving on to a different role. So I just want to really say thanks to particularly to Tony, Eric, Chris, and Judith. I think the impact you've had on the pack has been absolutely phenomenal, and the way you've helped us to reshape the way in which we look at things and the advice that you've given really has been first rate. I think the other observation I'd make is, the way that finance now is working with the departments is a much more commercial and focused manner than was what we inherited. The really good news is the new chair is a lady called Helen. She's very different to me in that she's intelligent, diplomatic, and charming. So the meeting should be good. So thanks very much to everyone, and I hope you have a. Oh, sorry. And the last thing is, I do want, when COVID is over, to take out Tony, Eric, Chris, and Judith as a real thank you for the work you've done. I know that I promised last year and we couldn't, but I really would like to do that, and we'll go somewhere pretty special. Okay. Thanks very much indeed, and have a great evening, everyone.
Thanks, PJ. Excellent. Thank you.